The Neurobiology of Addiction. Addiction is linked to many of the brain systems involved in motivation and reward. Most addictive drugs, directly or indirectly, cause the release of dopamine in the reward circuit of the mesolimbic pathway. Addictive drugs are thought to hijack neurosystems that mediate behaviors normally directed towards natural rewards, such as food, water, and sex. While dopamine is critical for acute reward and the initiation of addiction, end-stage addiction results primarily from cellular adaptations in anterior cingulate and orbitofrontal glutamatergic projections to the nucleus accumbens. These changes are believed to reduce the capacity of the prefrontal cortex to provide executive control over compulsive drug seeking. Addiction also produces persistent stress and depression, as the central nervous system and hypothalamic pituitary adrenal axis are chronically dysregulated by corticotropin releasing factor. This can cause long-term increases in mesolimbic dopaminergic neuronal excitability. With time, cues associated with drug taking, rather than the drug itself, can excite dopaminergic neurons. Structural changes within the nucleus accumbens also produce increased sensitivity that may perpetuate the intense cravings and lead to the high incidence of relapse that occurs in addicts. Addiction is a primary, chronic, neurobiologic disease, with genetic, psychosocial, and environmental factors influencing its development and manifestations. Its behavioral characteristics can include impaired control over drug use, compulsive use, continued use despite harm, and craving. It is not defined by physical dependence, which is the state of adaptation that is manifested by a withdrawal syndrome that can be produced by abrupt cessation, rapid dose reduction, decreasing blood level of the drug, and administration of an antagonist. Addiction is also not defined by tolerance, which describes the state of adaptation in which exposure to a given dose of a drug induces biologic changes that can result in diminution of one or more of the drug's effects over time. Alternatively, escalating doses of a drug are required over time to maintain a given level of effect.